Dozens of volunteers in Middle Georgia are preparing themselves in case of a natural disaster. And in the event it takes out a hospital, the North Central Health District wanted volunteers to learn how to work a portable one.
I spoke with volunteers who say the mobile unit could help save lives in the case of an emergency. In the blink of an eye, it can be set up anywhere. 9 40 by 32-foot tents that can house up to 50 patients in the case of a natural disaster. Dozens of volunteers across Middle Georgia worked on setting up a mobile surge unit, which used to be known as a portable hospital.
Basic care is pretty easy in there. Anything major, you can't do x-rays and you can't, do MRIs and those kind of things. But basic nursing care, basic medical needs could be met.
The state has 8 of them, ready to go in case of emergencies. Judy McCarg knows firsthand. She was a nurse when a tornado ripped through Americus, Georgia, destroying Sumter Regional Hospital in 2007. McCarg says the mobile surge unit there helped hundreds of people.
It gave us a good opportunity to be able to triage people, make sure that any immediate medical attention that needed to happen could happen.
These mobile surge units are stocked to the ceiling with equipment, making sure doctors and nurses have all the things they need to save as many lives as possible. Lorice Bentley gave me a tour of the tent. She says regions in the state help each other when disasters happen.
Basically, if there was a disaster here, then folks in this area over here could move in and help them, and that could bring their assets to them and help set up.
The main goal for volunteers is to have the unit up as quickly as possible.
We want to save the medical folks as much as possible. They need to conserve their energy because once we get patients, they're needed for that.
Super cool. The mobile surge unit only takes about 10 minutes to inflate and set up. Volunteers learned how to correctly install and break down the tents, and that particular unit is being housed in the North Central Health District.